The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, cosmetic dentist Dr. Guy Lewis gives his patient renewed confidence with her new smile. Cosmetic surgeon Dr. Michael Thornton explains the benefits of fat transfer for facial rejuvenation. Interventional cardiologist Dr. Annie Varghese talks about the cause and treatments for heart palpitations. Bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
Laughing not only eases stress, promotes social bonding, and lowers blood pressure, it may also boost your immune system. So bring some humor into your life.
After my pregnancy, I started seeing my teeth weakened with the pregnancy, and I started having some issues. My cavities were profound, and it had affected my teeth. I wanted to have, where I could smile, and I think about being embarrassed about my teeth and the way they looked.
And so she came in and she wanted to see if something could be done. And I think she was real apprehensive about, man, this is going to be really bad. And, yes, she needed some work done, but I could see, and because this is what I do, the great majority of the time, this is what my emphasis is, I knew I could fix it and make it look awesome.
I'm glad to say that, he gave me a solution, and, there's hope. We could get you that smile, no problem. And that was like the biggest relief ever.
Giselle is an example of what I see a lot. People come in, and unfortunately, a lot of them have been to dentists who have told them that there's not much hope for them, or they can't do a certain procedure, or they only give them like one option and it's not a very good option. I think one of the advantages to coming here is that people can have hope when they've been told there's no hope, or have options when they've been told maybe they only have one choice of how a treatment can be. And so I'm confident in what I do that I can deliver a result and make it look great.
I don't have to think about it anymore. When I smile with confidence, and that's something I don't even think about. It's my smile says everything. People think I'm happier now. People think like, oh, what a happy lady, you know, because I smile more.
So now Yusel is very happy. She's more self-confident. She's more vibrant. She just loves life, and she just exudes that. Yusel's just full of life, and she looks great, and very, very happy.
The confidence that it brings, that you get from having a good smile and having a confident smile, is invaluable. I definitely know that if you go to Dr. Lewis, he's going to give you the smile that you've always wanted.
Best Stocks Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
In my 20s and early 30s, I had 6 years of fertility treatments before I was able to conceive, followed by uterine cancer when my son was 18 months old. Both of those caused me to gain a great deal of weight, and I put it off and put it off and put it off, not thinking that insurance would ever cover the surgery. And then I went to see Dr. Frenzel, found out that it would be covered by insurance, had the surgery, have lost all of the weight, and I'm going on 3 years post-op now, and it has been wonderful.
We got Stacy approved. Let us do the same for you. Call now and begin your transformation.
When people hear about facial rejuvenation, it's more than just surgery. It's all about non-invasive procedures, including fat transfer, lasers, Botox, different things that you can do to the face. So it's not always about surgery. So when I say facial rejuvenation, you're just improving the face. You're not actually performing major surgery on the face. One of the things that I found to be very successful as part of the facial rejuvenation procedures is fat transfer. Facial rejuvenation using fat transfer is very effective because you can use it on men and women, especially a lot of people who are trying to get back into the workforce. They're coming in and they just want something really quick. They want something that they can get done, and within a matter of a couple of weeks they're back on track. So fat transfer is really good for that. You can put it in different areas of the face, like lifting the eyebrows. You can put it under the orbital rims and the nasolabial folds. You can put it in the lips. And then you can do some laser work. And just little simple things like that can take the patient a long way without doing major surgery. Fat transfer is basically taking fat from another part of the body, harvesting it, and rinsing it of all of the oils, and then putting it back in somewhere else. We put it in particular spaces within the face, and it stays there. It's not just a gel-filled area. When I put it in, it does stay. It doesn't move around. A lot of people ask that question, but it's their own fat, it's their own body, and so there's not going to be an immune problem or a rejection problem or infection. The complications are relatively low as long as you use good surgical techniques and adhere to good surgical techniques. It's known to last for several years, if not forever, but you have to also remember that the body and the face do change over time. So you're going to lose weight, gain weight, the facial anatomy is going to change, the bone structure is going to change, the soft tissue will change. So it's a procedure that lasts a lot longer than your hyaluronic acid fillers or these dermal fillers that we put in. And I usually use those for temporary results that you maybe want to get 3 to 9 months out of. But if somebody wants longer lasting effects, then I'll use fat transfer.
What vaccines are important? Well, you should get vaccinated for the flu every year. The flu shot is very important, and you can't get the flu from it. A few people feel a little ill for a day or so, but that's not the flu. It's important to get the flu shot every year. The pneumonia shot is important to get if you have diabetes, asthma, or if you're over age 60, and also if you have kidney or liver disease. Young people in their teen years should have the meningitis vaccine twice, 5 years apart. Now the tetanus shot is a problem. A lot of people have the DT, that's a small D and a big T. That protects you against tetanus. However, everyone needs at least one Tdap, that's big T, little d, little a, big P. That protects you against 3 diseases. It protects you against tetanus and pertussis, which is the whooping cough, as well as diphtheria, which is a throat infection. You just need one of those, and then you can go back to the little d, big T every 10 years. So get your shots up to date. They don't hurt that bad. We're big people now. We can take shots without crying.
I was pretty healthy up until I hit my 30s, and when I hit my 30s is whenever I was diagnosed with diabetes, and then from that point on, they start treating you right then for cholesterol. They start treating you for high blood pressure. I had started taking tests, and they changed my blood pressure medicines up. I woke up one morning and my heart was just out of control.
He presented initially with palpitations. Palpitations because of medication that he was taking for high blood pressure. He was not tolerating a medicine. And this medicine is a great medicine for blood pressure, but for him, it caused palpitations. So here's a classic example of how medications are studied, tried and true, used for years, but each patient is their own entity. Each patient processes medications in a different way. And for him, this medication was stimulating his heart, not quieting it down.
I would feel pretty confident that if it kept going the way it was going, I would end up having a heart attack. A lot of blood work was done, and once we pinpointed the problem, we put me on the right medication. I've been fine ever since.
And I had to, of course, immediately take that away, give him other medications that proved to be beneficial for his heart rate and his blood pressure. And he has done very well over several years, been very faithful to our practice, and brought many of his family members because of what we were able to do for him.
As far as how I feel now versus how I felt from the beginning, I feel 100% better, and not having to worry about waking up in the morning and your heart just be racing out of control. It's a good feeling not to have to worry about that taking place again.
Bill is doing fabulous. He is able to run his business. He brings his family members to be checked because he knows that there are rules and you follow the rules. And when you follow the rules, you do well.
The outcome of it is pretty good. I mean, like I said, if you control it, and I stay on, and I take the magnesium pills, and it keeps everything under control. I haven't had any issues since. I expect to live for a long time, I hope.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, ENT surgeon Dr. C.T. Wynn talks about how he treats those with postnasal drip and deviated septums. Minimally invasive spine surgeon Dr. Douglas Wan talks about his approach to spine care. Houston Northwest Medical Center features its breast center. Facial plastic surgeon Dr. Yadro Ducic helps his patient improve her appearance and quality of life with a facelift.
It's important to first determine that if they're an appropriate candidate for a facelift or not. The general principle is you have to have enough looseness of skin and redundant skin to be a good candidate for facelift. If you don't have enough looseness of skin or laxity, it just won't work very well. You have to preserve the central third of the face, so this oval, if you will, because that's really what defines us as uniquely individual.
I am getting older, and teaching is my third career. And what I observed was the older looking teachers were losing their jobs. And I just wanted to look as young as I could. I had tried a variety of other things, other procedures, and I finally decided to just go for it and go to Dr. Ducic and get everything fixed up. I was impressed by his place of business, as well as his people were all very friendly and helpful, and they just made me feel comfortable. It was overall a positive experience, and I felt like he really knew what he was doing.
We have so many minimally invasive techniques available today that really have very little downtime, have excellent results, and make you look more youthful and fresher, because that's the whole point of everything. It's the point to look better. And however we can accomplish that, that's easiest on the patient, that's what we want to do.
I don't think he does things that don't need to be done. So he doesn't push more than you would need, whether that be shots or surgery or whatever. He does what he thinks is going to give you the best result. I definitely am glad I had this done. Most people have no idea how old I am, so I feel pretty good about that. Nobody's tried to fire me for being too old to teach, so I feel pretty good about that. And I'm very happy with the results, very happy.
Sunflower seeds can help protect your heart. Consuming a quarter cup of these seeds delivers half of your daily value of vitamin E. Vitamin E helps keep your heart healthy and fights infections.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple courses of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what what he can do for me and what will be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with a very complex spine problems. However, not everyone may need spine surgery, so we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the Spine Care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Sarah has a question for Dr. Michael L. Thornton. What is a Brazilian butt lift?
A Brazilian butt lift is basically a 2-in-1 procedure. It's a procedure where you're performing a lot of liposuction to contour the waistline, okay? And once you take all that fat out during the liposuction procedure, then you put it back in the patient's butt. So it's called a Brazilian butt lift. And what it does is it gives them a nice waist to hip ratio, okay? You want to get a small waist with a nice round bottom. And you put the fat back inside their butt. Instead of throwing away the fat, you're actually harvesting the fat to put it back into their butt and sculpt it so it looks really nice. And there's a few tricks. It's a very artistic procedure. It's not something for everybody. You have to know what you're doing so you can make it look good, because not everybody can make a butt look good.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Here at Houston Northwest Medical Center's Breast Center, we focus on the patient and giving them the best quality care possible. The Breast Center here at Houston Northwest is a comprehensive breast center, meaning that not only can we do screening mammograms, we can also do the diagnostic portion, ultrasounds, MRIs, and biopsies.
I'm currently the medical director at Houston Northwest Medical Center. My primary role is interpreting screening and diagnostic mammograms, breast ultrasound, and breast MRI for detection of breast cancer. Also to determine clinical issues. If a patient comes in with a palpable lump, we want to find out what it is. It doesn't mean it's going to be breast cancer. It may be a simple cyst, it may be a benign tumor, but that is part of the workup that I'm involved in.
All of our nurses are certified nurse navigators here. They help the patient walk through the system, whether it's just for a screening mammogram or all the way through surgery. They help them navigate their care.
At Houston Northwest Medical Center, we have 4 breast patient navigators. We are very fortunate to be able to do what we do. Very few hospitals in the area have the opportunity to have this many nurse navigators, and from the beginning, from screening, from going out into the community, it's all about deliverance of care and continuity of care. So if you just make sure that that care is not broken, then one passes a torch to the next person to make sure from the time that she got her biopsy, from the time that she got her diagnosis, that we actually use the library to give her all the information that she needs to arm herself before she goes to see the surgeon.
At Houston Northwest Medical Center, we're very fortunate that we have a multidisciplinary breast cancer conference every 2 weeks, so twice a month. Every patient that is diagnosed with breast cancer at this hospital will be presented at a conference that is attended by radiologists, pathologists, breast surgeons, oncologists, radiation oncologists, and plastic surgeons, and the nurse navigators.
This is an excellent way for the patient that has been recently diagnosed have a treatment plan mapped out for her by specialists that come to the breast conference.
The Breast Center at Houston Northwest Medical Center is the only certified center of excellence in Houston, Texas. We have a monthly support group called Care, Share, and Be Aware, where newly diagnosed patients can come and share their feelings. They can also bond with other breast cancer survivors to interact with them and learn from them.
We always say no one chose this journey, but if you're walking the journey, you're not going to walk it alone, because we're going to walk it with you.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.